So I want to begin with a quote. When we were kids growing up, when somebody said to you, "Where do you live?" the only way that you could describe where you lived would be to say, "On the way to the dump." And that in itself is a kick in the gut. You were already fighting racism and trying to do your best to be accepted for who you are. And then you add on top of that, that you live in an oppressed area that has a dump. And that's just like a double whammy. And it's hard to get kids to have any sort of hope, I guess, that things can be better, things will be better. So this is a statement that comes from a resident of the African Nova Scotian community in South Shelburne, along the South Shore of Nova Scotia, where I did a series of workshops to get a sense of the mental health impacts of environmental racism. That workshop, that series of workshops was done last year, just before I left for McMaster. And this particular quote discusses the relationship between the landfill in the community and its triggering of various mental health problems in the community, such as isolation, PTSD, alcohol and drug abuse, depression, and anxiety. So for many of the residents, environmental racism has taken an emotional toll, a psychological toll, which they discussed during the workshops. So what is environmental racism then? How can we define it? Well, I always love to use this quote from James Desmond. James Desmond is from the African Nova Scotian community of Lincolnville. He's been an activist there since at least 1974 around the landfill that has been in the community since then and is still in the community. I love this quote because it's simple, but yet it's layered, and it actually connects to the more academic definition of environmental racism, which I'll discuss a little bit later. So when we met for the first time in 2013, this was the beginning of my project. And I wanted to, because I knew it had to be community-based, I wanted to go down to meet community members and start developing relationships with them. And we filmed those workshops for a video or a documentary that is on YouTube called "In Whose Backyard?" And this is what James said in terms of defining environmental racism. He says the practice has been locating industrial waste sites next to African Nova Scotian native and poor white communities, communities that don't have a base to fight back. You ask if that's environmental racism, it's environmental racism to its core. And it's simple as you see, but when you look into it, you see many things, many facets of the definition of environmental racism. First, when he talks about African Nova Scotian native and poor white communities, he's certainly saying here that this is an issue that disproportionately impacts non-white and racialized communities. But he's also saying that it does impact white communities. Those white communities tend to be low income or poor. What he doesn't say here necessarily, but what I found in doing the work is that it also impacts communities that are isolated, whether they're isolated because they live on reserves, as is the case with Indigenous communities, or because they live in out of the way semi-rural areas, as is the case with most African Nova Scotian communities, which is very different from Black communities in Ontario and Quebec, although we know that there are rural Black communities in Ontario, certainly. But in Nova Scotia, most, 99% of the Black communities are in rural or semi-rural areas. So this is an issue of, based on what James is saying here, it's an issue of race. It's certainly an issue of social class. It's an issue of income. What he doesn't say here, but which is also the case, is that it's also an issue of geography, where you live. Here's a much more kind of academic definition of environmental racism that was put forth by Dr. Robert Bullard. Dr. Robert Bullard is often referred to as the father of environmental racism. He started doing his work in the very late 1980s. I believe his first book was called Dumping in Dixie. And he's teaching at a university in Texas currently. And he talks about this very similar issues to what James Desmond on that slide talks about. He talks about disproportionality, the notion that certain communities, mostly racialized in Canada, certainly Indigenous communities, are disproportionately located to greater exposure. It's this notion that these communities or that government tends to cite hazardous industries, polluting industries in communities of color, racialized communities, and specifically Indigenous communities in the case of Canada. In the United States, it's very similar. It's Indigenous communities, it's Black communities, Hispanic communities. We don't have large Hispanic communities in Canada, so we don't often talk about communities in Canada other than mostly Indigenous, and in the case of Nova Scotia, I would say Black communities. He also says it's about the lack of political power that these communities have for resisting the placement of these industries or projects in these communities. And when we go back to the definition of environmental racism that James Desmond put forth, he talked about race and class and income in many ways. And I also mentioned rurality or where you live, geography. And the intersection of those issues, of those identities, to me, gives you less power in terms of being heard by government. It certainly doesn't mean that you're not engaged in acts of resistance. You know, these are communities I know have a voice, they have a strong voice, but that voice is often not heard. These are communities that are lacking in political power. They're not typically remembered by government. They're not thought of. They're the last people that people think about because of race, class, and where they live specifically, because they're isolated, very easy to forget. So that lack of political power then makes it very difficult to fight back in a way that you're fighting back results in positive outcomes. So these communities have fought back, you know, they fought back for years, but it's taken them a long time to get redress or to have their issues addressed. It's also about the implementation of policies that sanction the harmful and in many cases life-threatening cases of poisons in these communities. In other words, it all starts from policy, as everything does. And when we talk about housing, we talk about health, we talk about education, we talk about employment. It starts at policy. It's about the people who get to make policies, the people who get to make decisions, in this case, about where a particular landfill goes. So environmental racism doesn't just happen. The spatial patterning of industry, primarily in these communities, doesn't simply happen. It happens as a result of policymaking, specifically environmental policymaking, and the decisions that are being made within departments of environment, right, across the country in the case of Canada. It's also about the disproportionate negative impacts of environmental policies that often result in differential rates of cleanup. So in this case, you can ask, why does it take so long for these communities to get cleanup, to have their issues redressed? In the case of, I think of a Nova Scotian community, Pictou Landing First Nation, you know, the mill started dumping effluent into Boat Harbor in 1967, and only in 2020 did the government then decide to shut down the mill. So often you have to ask, you know, why does it take so long for certain communities to have action taken around some of these issues? And then finally, it's about the history of excluding the communities that are actually most impacted, right? So this is kind of a definition we never really talk about, which is if you're not consulting with communities that are most affected by this particular issue, if you're not giving them a seat at the table in terms of environmental policy making or decision making, then nothing will change. So we see environmental racism manifest over generations, and part of the reason is because we are not including these communities who have something to say, certainly, about how this issue is impacting them and how they'd like to see this issue addressed. And we're not doing it in often culturally applicable, culturally appropriate ways. You know, there's certainly the technicality of engaging communities, but are you engaging them in culturally specific ways? And are you meeting them where they're at? Are you going to their communities, or are you expecting them to come to your community? So this history, this ongoing history of excluding the communities that are impacted, Indigenous communities, Black communities, other communities, is really about the fact that these are communities that are less likely to be on environmental decision boards, commissions, regulatory bodies. How often do you see these communities at ENGOs, for example, right? It's very rare. ENGOs are taken up. I think there are statistics in Canada, it's mostly white females that work in ENGOs. I saw that certainly in my experience in Nova Scotia, but the communities that are most impacted are typically not on boards and not at these organizations helping to make decisions. I want to kind of start a little bit off with a case study. I want to do some case studies. I want to begin with Nova Scotia because that's where I started my work. And I will say just in general, there's been a legacy of environmental racism in Canada for about 70 years. Sounds like a long time, but we'll get to Shelburne and you'll hear how long they've had a landfill in their community. But what you're seeing on screen is Sabaganagati First Nation in Nova Scotia. Between 2014 and 2021, Sabaganagati First Nation opposed the development of the Alton Gas Brine Discharge Pipeline project near the Shubenacadie River in Nova Scotia. And between 2014 and 2021, there's been lots of action. I've been actually very impressed with this particular community, just the actions that they've taken online, on Facebook, on social media, but also in person to address this issue. It's like it's like a kind of, it's like a class on social movements or a class on resistance activities, the way they've done it. I don't know if they were just kind of going along doing it, but when I look back and I think of myself, you know, obviously as somebody who's a researcher looking on, I thought, wow, I just love the strategy that they used over the past several years. So yeah, I just loved being a part of the work that they were doing over those years. I mentioned Pictou Landing First Nation a little earlier. This is Boat Harbor. A journalist took this photo when he was on a plane, and he sent it to me. And this is Boat Harbor. As I said, Boat Harbor was the pulp mill. The pulp mill at that time was dumping effluent into Boat Harbor, which up until 1967 was a pristine hunting and fishing ground for the Indigenous community. And I should just say the Indigenous community in Nova Scotia is called Mi'kmaq, the Mi'kmaq people. So 1967, it was a pristine area. That's where they did kind of sacred, you know, did their fishing, hunting, and then all of a sudden this mill was open and started dumping wastewater into Boat Harbor up until, as I said earlier, up until 2020 when an announcement was made, which I'll come to later. This is a community like other communities, I would say, you know, we've certainly experienced the health effects of toxic contaminations. I remember when maybe the same year I created the project, the Enrich project, I spoke with a Mi'kmaq man from Pictou Landing First Nation. He was telling me stories, cases of health issues because of Boat Harbor, you know, lesions on individual skins, the high rates of cancer in his community, just really harrowing things that I had never heard of. And this was just before I started the project. So I had a good sense, certainly, when I took on the project, I guess to a certain extent, but also just listening to him speak about the issue, the significant health effects of environmental toxins on these communities. You probably heard of Amjinwang First Nation. This is in Ontario. So it's often referred to as Chemical Valley near Sarnia, Ontario. And I find this case extremely stunning. You know, to have over 60 petrochemical facilities surrounding a community is very stunning. And this is what this community has been experiencing. So over 60 petrochemical facilities within a 25 square kilometer area. And similar to other communities, this community would point to this project and say the health effects that we've experienced, the high rates of cancer, the high rates of reproductive illnesses, birth anomalies, like the ratio of male to female births, which is out of whack, which is not in line with the Canadian average, and other health issues is due to this facility, over 60 petrochemical facilities. And how could you argue that perhaps it's not when you're surrounded by so much toxin? So this is, to me, one of the worst case scenarios of environmental racism, probably in addition to Pictou Landing First Nation. And I'm sure you've heard of Grassy Narrows First Nation. So Grassy Narrows First Nation is near Kenora, Ontario, and they've been concerned about the health effects of mercury contamination of the Wabigoon English River near their community during the 1960s and the 1970s. The chemical plant at the Reed paper mill dumped 9,000 kilograms of mercury into the river. It's estimated that 90% of the population in Grassy Narrows have symptoms of mercury poisoning. Those symptoms include neurological problems ranging from numbness in fingers and toes to seizures and cognitive delays, even though the mercury entered the food chain decades ago. So in April, there was I believe it was a CBC article that talked about the current health issues that community members are experiencing. The ones I just mentioned here, numbness in fingers, seizures, cognitive delays, they're still experiencing some of those issues, even though, as I've said earlier, this happened quite a while ago. I think a lot of people are talking about Wet'suwet'en First Nation probably more than any other community right now. I became aware of the issue probably 6 years ago. So Wet'suwet'en First Nation. So this is a community that's been experiencing mass demonstrations, sit-ins, and blockades, and that's gripped various parts of Canada over the movement to support the leaders of Wet'suwet'en First Nation, who are opposed to a multi-billion-dollar pipeline project near their community in northern BC. I think it's lost on a lot of people that Black communities are impacted by environmental racism. I'm not sure why, but it could be that maybe most of the cases I have found to be in Nova Scotia. And once again, I'm not sure why that is, but I've come to a few conclusions, and that goes back to what I said earlier. Black Nova Scotian communities tend to live in isolated, semi-rural communities, right? So having their voice not being heard is often due to that, being in isolated communities when you don't have access to other resources that most of us take for granted. There probably certainly are communities in, obviously in Ontario, other parts that are dealing with environmental racism, certainly. I'll talk about one later, particularly in Scarborough. But I found in my kind of research that it seems that Black Nova Scotian communities are disproportionately impacted more than other Black communities across the country. I just think there are quite a few cases in Nova Scotia of Black communities dealing with this issue that I haven't found elsewhere. And the first one would be Africville. You probably hear about Africville a lot during Black History Month. I mean, when I was in Nova Scotia, yeah, that's when I learned a lot about Africville, certainly during Black History Month. And there's certainly a lot of books on the issue. I consider this to be a case of both gentrification, urban renewal, and environmental racism for a number of reasons. In general, this community was expropriated. They were being pushed out by the city of Halifax because the city of Halifax wanted to come in to kind of engage in industrial development, right? So they needed the community to leave. And the community actually dispersed to various areas, including Uniacke Square, which is a very low income part of the north end of Halifax, which is Halifax kind of urban area for Black communities that reside there. It's one of the few urban areas where Black communities in Nova Scotia reside. And they needed the community out. So they tried to push them out in various ways. Some would say one way being actually burning down the church late at night. People don't really know who did that, but some people believe it was a way to get the community out. If you look at some Google photographs, you'll see a dump truck where they're kind of moving little children out of the area. So they really needed the community to get out for industrial development. But in the wake of the pushing out, in the wake of the expropriation, it left a number of environmental hazards. And that's why I say it's both a case of gentrification and environmental racism. Those environmental hazards include a fertilizer plant, a slaughterhouse, a tar factory, a stone and coal crushing plant, a cotton factory, a prison, 3 systems of railway tracks, and an open dump. Here's Lincolnville. So you saw a photo of James Desmond earlier, who actually defined environmental racism. This is his community, Lincolnville. So Lincolnville has had both a first and second generation landfill. The first generation landfill, as I mentioned earlier, was put there in 1974. And the second generation landfill was put there in 2006. So I think the community believed that the government was going to remove the first generation landfill. There was a lot of hope, but then pretty much a slap in the face when it was announced that they were going to put the second generation landfill on top of the first generation landfill. So this is a photograph that my research assistant took in 2013 when I said we went down to the community to meet with them, including James Desmond. We just went to the landfill site and we took this photo. So like the other communities, they would say we have, since that landfill has been there, we've had increasing rates of cancer, respiratory illness, rare cancers, they would say respiratory illness, etc. Shelburne. So if you saw the documentary, There's Something in the Water, you would have met Louise DeLille, the environmental activist in Shelburne. I'm talking specifically about South Shelburne. You've got North Shelburne and South Shelburne. South Shelburne disproportionately populated by Black Nova Scotians. North Shelburne mostly white. This is an issue of environmental racism, but also what we call public infrastructure inequalities, because North Shelburne, which is mostly white, have always been on town water, municipal water. South Shelburne, never. South Shelburne is surviving on well water. So 2 things are happening in this community. The landfill that was placed there in 1943, and the community, the Black community, placed in the Black community in 1943, the Black community would say everything went into that landfill. Municipal waste. I think there was a base there. Syringes from the hospital. They said everything and anything went in there. So they're dealing with the landfill and the health effects from that, because when I met with Louise in 2015, she said, I've never heard of this term environmental racism, but could that be the reason why so many of our community members have cancer, have died of cancer, and have multiple myeloma, which is a rare, as you probably know, a rare blood cancer. I said, I can't say definitively, but it's a term that is often used. And she, you know, she liked to have a term because it was something that made sense to her now, or it was something to kind of hang her hat on. I mean, people have an issue with the term environmental racism. Sometimes they think I created it, and I said it wasn't created by me. It was created by what's his name, Reverend Benjamin Chavez in the early 1980s. So don't blame me. It's just a term. But some people like the term, like Louise, because all these years the community was wondering, like, what's happening to us? We don't really understand it. So when I used the term, she said, Ingrid, is that the reason why this is happening? Is that the reason? I said, I can't say to you yes definitively, because that would mean I'm not responsible. I'm not a responsible researcher, but I'd like to hire you to do some focus groups in your community so we can hear from community members about what they feel about the landfill. So the landfill is one issue. The issue is the fact that this is a community that's been on well water that tends to be much more contaminated. Well water, you'll find people being on well water in rural communities. I'm not sure if that's the case in other parts of Canada, but in Nova Scotia, yes, we know it's more contaminated. And it's just been a challenge for the community to address this particular issue when one segment of the community in the north enjoys municipal cleaner water and they don't. So over the years, I've been addressing both issues, the landfill and the well issue in Shelburne. But these are, to me, very obvious inequities, racial inequities, in a community that's divided geographically, but it's also divided in terms of what they have access to and don't have access to. Toronto. So in the Greater Toronto area, air pollution is concentrated often in highly racialized areas like Scarborough and Etobicoke North. For example, the notorious case of the McClure radioactive site in Scarborough led a group of immigrant citizens who had been given radioactive land without warning into a decade-long legal battle with the Ontario government. I need to find out a little bit more about this now that I'm in Ontario now. It's been a year. I'm trying to make connections and partnerships with different people. So I want to learn more about this, but there is a book that I cited at the end of my PowerPoint slides by Heitinting from 2016 that talks more about this legal case, if you want to know more about it. So I want to talk about the mental health impacts of environmental racism because I think it's a topic that's often not discussed. We often talk about the health impacts, and that's clear, or maybe not clear to everybody, but it's something that's much discussed. But the mental health impacts, not so much. And I started realizing that this was an issue when collaborating with the folks in Shelburne, particularly Louise, who would say to me, we have high rates of substance dependence and anxiety and depression in our community. And at that time I was thinking, okay, not clear how that relates to environmental racism, because this is a community that's also dealing with a lot of other things, racism, a history of racism. It's one of the oldest Black communities in Nova Scotia. They're dealing with segregation geographically. There are lots of things that will contribute, obviously, to depression and anxiety and substance dependence in this community. But many members of the community talked about the mental health impacts very effectively when I held the workshops last year. And I thought it was worth it to actually start looking at this particular issue when I deliver presentations. So there are various studies, certainly over the years, that say that residents in oppressed communities located near environmental hazards and other stressors is often linked to poor mental health outcomes. And you see some examples of studies there. So for example, the participant that I mentioned from the African Nova Scotian community or this is another participant actually in Lucasville. Lucasville is another historic Black community. It's been in Nova Scotia for over 300 years. And they were dealing with an equestrian farm around 2015, a smelly equestrian farm. And one of the community members reached out to me to see what can be done. And thankfully, eventually the issue was resolved, which doesn't typically happen. But this is what was said during one of the meetings. And then talking about these physical industries, there's also a mental cost to that as well, to our mental health and well-being. When we know that all this is happening around us and nobody's concerned enough to do anything about it, that takes a toll on your mental health. So it's not only our physical health that's being affected here, but also our mental well-being. So these combined factors then may contribute to higher levels of perceived stress, reduced cultural pride, and reduced beliefs in personal and communal abilities to reach future goals. So this whole idea of being a racialized community, low income, geographically isolated, dealing with environmental hazards like this equestrian farm and feeling like you're never heard, of course, that's going to take an emotional toll, particularly when you've been trying to deal with the issue for decades, as is the case with many communities, right? So I think people kind of undermine that emotional, psychological toll that not being heard over the years takes on you while dealing with other kind of social, economic factors, which is a reality of living in rural, low-income Black communities. So it's those intersections that I think community members often want to express to me. It's not simply about the landfill. It's also about all these other interlocking issues. And this certainly is what this particular participant was discussing. So I want to talk a little bit about CTDs discussed by Couch and Coles. And they observed that the presence and or perception of environmental contamination may lead to psychosocial stress in the individual, the family, and the community. So they examine how chronic technological disasters, like that means CTDs, generate social stress. CTDs refer to conditions of perceived or known man-made contamination of an environment that persists over time. And they discussed 5 main elements for the unique stressors associated with CTDs. This has been kind of documented in the literature. And when I look at these 5 issues, I think back to the communities I work with and I say, yeah, that's been kind of expressed to me in many ways by these communities. But at that time, I didn't kind of put it all together in terms of the mental health toll that it was taking. So human loss and bereavement, certainly, you know, Louise DeLille talked a lot over the years to me about the loss, about death in her community, the death specifically of Black men, to the point where there was a journalist who called Shelburne, South Shelburne, the community of widows, because Black men had died out, leaving Black women in the community to fend for themselves. So, and then there was a certain point, Louise was sending me Facebook messages telling me another person had died last week. Another person died the week before. It was quite a lot. She doesn't do it anymore, but it was taking a toll on me. You know, I was like, so somebody else died in your community? It seemed like somebody was dying every week, right? So this kind of notion of human loss and bereavement is real. Environmental losses and contamination. So in all those communities, they talked about pipelines, they talked about landfills. So talking about specifically environmental degradation in their communities and the kind of social health impacts is another part of this definition. Feeling of betrayal by government and mining and milling companies. So in the case of the communities that I focused on, yes, feeling that the government does not care. Feeling betrayed. I think to Pictou Landing First Nation, promises were made decades ago that the mill would close near Pictou Landing First Nation, and they felt betrayed over the years because it never happened. It finally happened, as I said, in January 2020. But since perhaps since the 1980s, the government in Nova Scotia had been making all these broken promises, and there was hope. You know, hope was sparked, and the community continued to be disappointed. So the feelings of betrayal, I can certainly understand in terms of the communities that I was working with. Also, kind of fears, let's see. I'm just trying to move this screen here, I can't see. Fears about current and future effects, right? So wondering whether or not the issue is going to be addressed and whether or not more hazardous industries coming into the community. So I can turn to Pictou Landing First Nation. As I said, the mill was finally closed in January of 2020. But this year, I'm hearing some rumblings that the mill might be reopened. And that comes out of the work of journalist, forgot her name, Joan Baxter. Joan Baxter is a Nova Scotian journalist who's tracking this particular issue. She's hearing that the mill might be reopened. So imagine the kind of feeling that comes up for a community like Pictou Landing First Nation when you've waited for decades to have the mill closed, and then now you're hearing that it might be reopened, right? So that's a reality in each of the communities that I've been working with. And also prolonged duration of psychological effects. So many of these communities have talked about that, about the depression, the anxiety around having these industries in their community and future effects. psychological effects as well as physical effects. And anxiety and depression. Not all communities talked about this particular issue, but I would say South Shelburne, when we did that the series of workshops on mental health, because it was focused on mental health, it was a really great way to get them to talk about it. And I can feel that it was uncomfortable for many of them. But at the end of it, many of them said, this felt like a counseling session. We need to do more of this. I got a social worker to do the sessions, and he was very skilled. And I think that's why they felt it seemed like a counseling session. And we did that on Zoom, actually, the workshops, and they said, why don't we continue this? You know, this is just like a first stage. It's a study for Dr. Waldron, but we would like to continue this as a counseling session, because none of us are seeking out counseling because there's nothing in Shelburne. We can't access any services. So anxiety and depression is certainly real, and I heard a lot about that from South Shelburne residents. Couch and Coles also found that there are 5 main elements of the unique stressors associated with CTDs in many of these communities, and one would be uncertainty, right? The uncertainty of having these projects in your community, uncertainty as to whether or not the issues will be addressed, the uncertainty of whether or not you will be heard by government, etc., right? Uncertainty of all the work actions taken by these communities and their allies over the years as to whether or not there's going to be any real positive impacts. Certainly I saw that in all the communities. There was a level of anxiety, uncertainty that actually takes an emotional toll on communities. People also talk about housing and job security. When I think of housing, I think of Lincolnville, and the fact that people are aware that there's a landfill near Lincolnville, and people actually don't want to move into the community anymore. They don't want to buy homes. They don't want to live in the community. They don't want to open up businesses in Lincolnville. Many of the young people in Lincolnville actually moved out. So there was out migration because there were no opportunities, because there's a faltering economic base in Lincolnville. You have an elderly population who are retired, so they're not necessarily engaged in the economic sector of Lincolnville. And there's housing depreciation. People don't want to buy homes, as I said. So, and then people who can afford to leave and buy homes elsewhere certainly can. And those are people who are higher income people. So when people say, well, why don't they just leave? You know, they're talking about the Black community. If they don't like it, and if they're around hazardous sites, why don't they just leave? It's not that easy to leave, right? Because you have to have money in order to leave, right? So the issue of housing and job security and economics, financial security is big. It's an issue that to me surrounds the issue of environmental racism. Also, social rejection. So the quote that I kind of highlighted earlier talked a little bit about that, the shame of living near the dump, the taboo that, around living near the dump. Many of these communities feel the taboo around being Black or being an African Nova Scotian. Attached to that is the taboo of social rejection. That's the person who lives near the dump, right? As the person in the quote said earlier. So that's actually really, really big. And once again, cannot be undermined in terms of psychological toll. Media siege. Yeah, I noticed that a bit. You know, I mean, there was a lot of interest from media about these communities. They got a lot of attention. Shelburne got a lot of attention. I think the journalist who gave Shelburne a lot of attention really forged a really great bond with community members and with Louise. It's a community that's easy to kind of access in a way because Louise is so welcoming. But sometimes you're kind of cautious when you're a community about media, because sometimes they can spark kind of public fear. And sometimes it results in certainly judgment by the public. It depends on whether or not you get a journalist who's going to accurately tell the story, but not all journalists do, right? So when you put yourself out there for the media to kind of share your stories to the public, sometimes they get it wrong. Sometimes communities end up being judged or blamed for the issue. So communities, I've noticed, sometimes are often very, very cautious about giving interviews to media. And finally, cultural pressure, including conflicting public pressures and implicit social messages about how to behave, what information to believe, and what can be expected now and in the future. So here's Louise D'Elia. I spent a lot of time talking about her. I'm really grateful that I met her. She was a strong, or is a strong, environmental activist. And the reason I think we work so well is because she was willing to take the lead. You know, sometimes you get communities that want you to take the lead, and it just can't be done. You can't do this unless you've got somebody in the community who's willing to lead with you. And for me, Louise was that person. This is a photo from her in 2017. We were holding a press conference around a kind of environmental bill that was developed by EcoJustice in Nova Scotia. And we were at a cafe launching this bill. And she talked about the emotional toll on her community. She stated that environmental pollution not only causes cancer, but it also causes a kind of communal low self-esteem due to the stigma that comes with living near a dump. According to a member of her community, PTSD is prevalent in the south end of Shelburne and is rooted in the stigma and shame associated with living near that dump. So as she says, whether people want to admit it or not, that's where the depression and the self-medication comes from. Because I got diagnosed with a severe case of post-traumatic stress disorder from the things I went through in my life. But there's a lot of people in Shelburne, a lot of people I grew up with, especially my age, that got PTSD just from growing up on the south end of town and dealing with racism 24/7. Like every day when you'd go to school, it was like a battle, right? I dated a girl from the north end, and her mother literally told me, I don't want that south end garbage in my house. Like at 14, I heard this. And yeah, it was because I was Black, and it's because my family is from the road that the dump's on. So that kind of cultural distress combined with a general lack of response by government can certainly tamper with or destroy a community sense of empowerment. So as a health researcher, then, primarily grounded in sociology, a sociology of health framework is what I tend to use. I've tried to do various things over the years to address the issue of environmental racism. As I've gone on, I realize it's a really tough issue, and there's slow progress on this issue, as well as the issue of climate change. But I want to share with you now some of the things I've been doing over, I guess it's 10 years now, because I started the project in 2012, to address the issue in many ways. So since the fall, I think it's the fall of 2012, my Enrich project has been examining and addressing the ecological, health, mental health, political, and social impacts of environmental racism and climate inequities through community-based, multi-method, collaborative, interdisciplinary, and multimedia approaches that have included several activities and projects that I'll share with you right now. First is awareness raising. I thought this was important because when I started the project, people had not heard of the term environmental racism. And consequently, many people thought it was a ludicrous term and consequently doubted my work, doubted the project that I was starting to engage in. So I thought, what do I need to do? I need to create more awareness about this term. I need to unpack it, because if I want people to be empathic and I want people to act on it, and I'm trying to rally people around this issue, I'm trying to mobilize not just communities, but the public and young people, I need to unpack this term for them. And I need to indicate to them that this term is a systemic term, right? Environmental racism, just like any type of racism, comes out of policy and is a systemic issue that's structured into our social structures. So I did a lot of awareness raising, including events at the Halifax Public Library 2015 here. This stands as my favorite event because it was jubilant. It was a serious issue, it was jubilant, but it was also very serious. It was informative. And of course, as we do in most events, we get different people to discuss the issue from different angles. So here we have the one standing is Lenore Zan, who I developed the environmental racism bill with. We have community member in blue, Mary Desmond, no relationship to James Desmond, from Lincolnville. We've got Caroline Wright Parks from government. So I was trying to just share different kind of experiences, positions on this particular issue from different people in different sectors. And I continue to do that, try to hold events just to educate, create awareness, and hopefully to create some type of empathy in the public around this particular issue. Awareness raising also includes multimedia, of course. And I kind of consider the map multimedia. When I got people kind of doubting what I was doing, you know, they would send me emails and they would say, come on, Dr. Waldron, are you serious? And there was also a comment in the Halifax, was it the Chronicle? When they used to show comments, somebody says, what is Dr. Waldron saying? You know, environmental racism, is she serious? What's next? Environmental sexism? And I thought, what a comment. I thought the comment was actually clever and funny, and I did laugh. But I said to myself, well, I need to do something if people are doubting this work, doubting the reality of this issue. So I connected with a health geography student, and I said, what can I do, you know, just to kind of provide some more evidence? He said, well, you can map it. You know, one of the ways to kind of bring people to the project is to map things. Mapping is really a great way to present evidence, and that's what he did. So right here, you see a consolidated map, but if you go onto my website, you'll see one layer for Mi'kmaq communities and another layer for the African Nova Scotian communities. What this map shows is a location of incinerators, pulp and paper mills, landfills, something else, I forgot what it is right now, in African Nova Scotian and Mi'kmaq communities. The plan right now is to make it very multimedia, and I have an organization called ARUP in Ontario, in Toronto, that's upgrading this map. What I want is to download text, audio, video, make it a kind of storytelling narrative map. I had plans to do that a long time ago, and I never got to it. So I finally connected with this ARUP organization. They're doing the work. They're starting the work very soon. And I said, I'd love to be able to click on a link on this map and a video comes up, or an audio comes up, an article comes up, or we can click on a website, a kind of one-stop shop. So on environmental racism in Nova Scotia. So that's what they're working on right now. This is actor Elliot Page, Nova Scotia born actor Elliot Page. Well, it was a blessing when I connected with him. This would be October of 2018, perhaps. I was on my Twitter, my enriched Twitter page, and I had noticed him following me probably for 2 weeks, but didn't think anything of it, didn't connect it to the actor. At that time, I just thought, interesting. And then I went about my business. When I came back 3 weeks later, I noticed that that Twitter page was very active, lots of conversation. And this person called Elliot Page was actually promoting my book, promoting the Enrich Project, giving support to the communities on the front line. And I was like, this could not be the actor, you know, because I had seen the movie Juno twice. I loved it so much. I had seen Inception with Elliot Page and Leonardo DiCaprio. And I was like, no, I don't believe this. So I said, well, I better believe it. So I said, it is Elliot Page. So I reached out, and we spoke at the end of 2018. That went into another conversation in 2019, and we actually came to the decision to produce a documentary. He was nice enough to allow me to be a co-producer on it. It premiered at TIFF September 9th, 2019, and it moved to Netflix just right after COVID. It moved to Netflix, started streaming on Netflix March 29th, 2020, and now is on Apple TV as well. So this is a blessing, I think, for any academic. When we talk over and over again about knowledge mobilizing and how do we share it, I mean, sharing it to a global audience. Wow. And it's not just the thrill of that, it's also the response I got from people all over the world saying, I can't believe Shelburne doesn't have clean water. Dr. Waldron, please tell me what I can do. You know, there was a lot of people emailing me saying, tell me how I can help. And that's what you want, right? So this is a Netflix documentary based on my first book. This is a blessing. I continue to do other media interviews. Of course, I engage with media in other ways because I realize there's always going to be somebody who doesn't understand the topic of environmental racism, you know, so all sorts, just like any academic does, right? Television, newspapers, podcasts, etc. I continue to do that. It's very exhausting. I don't do it as much as I used to, but I think it's important. Research, of course, I'm a professor. I've got to do that. I've got to show the data. I'm very thrilled right now. I've done a lot of research, but I'm thrilled with the research I'm doing right now with Juliet Daniel at McMaster. This is a Dalhousie McMaster collaboration. I would say it's extremely multidisciplinary. I don't think I've ever been on a study that's so multidisciplinary. So we've got Juliet Daniel, who's part of this center. She's a cancer biologist looking specifically at race and cancer, and she's found some gene called the Chiso gene, I believe, in Black women. So she looks at ancestry and genetics with respect to cancer. I've got Charles Hostowski, who taught at McMaster, also taught at Dalhousie. I think right now he's in Saskatchewan. He's a kind of planner / archaeologist. He's on the team. I have a statistician at McMaster. Myself, I'm a sociologist. I have a nurse at McMaster. I've got a toxicologist at Dalhousie. There's more. I mean, it's really a large team, and it's very exciting. The ethics has been really challenging. I think it's because there's a Dalhousie piece and there's a McMaster piece, so we're still kind of in ethics a year later, I have to tell you. But I also think it's because of the whole biological part that Juliet's leading, the whole sample, blood samples, saliva samples, all of that makes things complicated. So we have yet to actually start the project a year after I've come to McMaster, but hopefully we can start it this year. Publications. I published, because I see myself as very interdisciplinary. I published in health, environmental justice, environmental sociology. Yeah, I just try to kind of publish anywhere I can, because I think I come at this from a very interdisciplinary perspective. So I can publish in many different types of journals, which is fun for me. And of course, in terms of publishing, my book was published April 2018. It's based on my journey conducting the Enrich project, the challenges I've had, the successes, the stories of the communities, the challenges they've had. And as a health researcher, I talk about in chapter 5, the health and mental health effects of environmental racism as well. So it was my first book. It was just me trying to share the journey that I had doing community-based research, the expectations that I had that I couldn't fulfill, particularly around Pictou Landing First Nation. I talk about the disappointment with respect to Pictou Landing First Nation. They simply were not ready for me. I wanted to go into the community, but they didn't know who I was, who's Dr. Waldron and why is she coming? You know, so I talked about the disappointments that I had in terms of not understanding maybe at that point that it's not about my timeline, it's about their timeline, and being patient. Eventually I got to Pictou Landing First Nation, like 4 years later, due to an activist who I had befriended probably in 2012. He said, I've been watching you, Dr. Waldron. I love what you're doing. I'd love to invite you to the community. That was 4 years later that I wanted, but it was the time, right? So it's a lesson that I learned. I think people kind of expect you to just know community-based research. It's not that, it's really difficult. But I realized that it's not my time. Who cares about ethics? Who cares about what my university says? It has to be on the community's time. Community capacity building. Well, I've always not wanted to be a professor who just collects data, goes into a community and puts it on a shelf. I want to give something back. And to me, giving something back is community capacity building, kind of developing skills and knowledge in the community so they can fly on their own, I like to say. And one of the ways I did that was to do water testing projects in Lincolnville and Shelburne. Because they were concerned about water contamination, they did not trust the government to do it, and they certainly didn't have the money to pay for it. I collaborated with a hydrogeologist and an environmental science professor and a University of Waterloo environmental science student in 2016 to do the first water testing project in Lincolnville. It worked so well that we said to each other, boy, we should create a new NGO. And we did. In 2017, April, we founded Rural Water Watch because that Lincolnville project went really well. We thought it provided a nice blueprint for an NGO. So what we have now, we continue to have is Rural Water Watch, which does water testing in rural Nova Scotian communities. And it's community capacity building because we test their water for free at no cost, of course. But we also go back to the community to train them to talk about how they can manage their drinking water supplies. We also show them how to test their own water. We do workshops on keeping your well healthy because many of them are in well water, as I mentioned. So a cracked well can lead to health issues, of course. Having a well for 20-something years, which many of these communities have, you know, they just don't know about wells. They don't know that having a well for 20 years can lead to some health issues. So we have this day called Well Water Day, I believe it's called, October of every year, where we do online and in-person education using infographics online and posters and sharing information. But we also go into communities. We kind of test water in 3 communities. We give them the test back and we teach them how to kind of manage their drinking water supply. So that's something I'm really proud of, this particular NGO, because it's tangible. It's actually giving something back to the community. It's not simply taking from them. Climate Action Services is a group of retired climate scientists that I met in 2019. And I did the first climate change workshop in 3 Black communities. Before then, I wasn't really that interested in climate change, to be honest, but I realized, of course, that it's an extremely important, timely issue, and I needed to get on board. So I connected with them, and we did a series of workshops that made the issue a lot more relevant than typically I think a lot of workshops do to these Black communities, make it more personal, get rid of the climate science language, greenhouse gas emissions, of course they need to know about, but we wanted to make it real for the communities. And there was a lot of hesitance in terms of signing up for these workshops. People were not interested, but after the workshops happened, great feedback. People said, loved it, can't wait for more. So right now I'm looking into a grant where I'm going to do some more climate change workshops because the response was so good. Even after people said not interested, after doing it, they were really excited about it. I do a lot of education and training, of course, and a lot of it has been with students. Certainly at Dalhousie, I got students from so many different departments that made me realize that environmental racism is so interdisciplinary. I didn't realize that before, but I was getting students from sociology, from the law school, from the medical school, from political science, from environmental science, environmental studies, planning. And I started to say, wow, why are so many different types of students in different departments so interested in this issue? And I realized that it had something for everyone, right? So that made me realize that the solution sometimes in addressing environmental racism and any issue is actually interdisciplinary collaborations. The problem is many of us stay in our silos. And I realized that staying in one silos does not address this issue. We can make progress on this issue if we all work together from our different disciplines. So student mentorship and training has been big. I often get students who don't have any way to connect with community, and they know that I was connected when I was in Halifax. I was connected to these communities, and they're sitting in their environmental science classrooms, probably thinking, I'm hearing about Alton Gas, but I wish I can connect with somebody. So I was a pathway in many ways for them to connect to community and to go up and meet the community for the first time. And I really love that. Many of these students were in experiential courses, or what do we call them? Yeah, experiential classes where they need to actually connect with an organization for credit. And I was often that organization that they called on. Legal remedies. I'm not interested in getting into the legalities of it all, but Eco-Justice, as you probably know, is an environmental legal organization across Canada, and they try to address environmental issues through various legal remedies. They opened up an office in Halifax in 2018. I immediately went down, I met with the lawyers there, and I talked about the communities I was working with, and they subsequently started working with Shelburne and all these other communities. I don't have any information to give you because the information is private. I can only get the information if I get approval from the communities, which I need to do soon. But what was really thrilling for me is that we had already done the water testing. So we were able to hand over water testing to Eco-Justice so they could actually make their case. So I thought, oh, that's convenient. I was really thrilled about that. I had been in contact with the Calgary Eco-Justice office to help Lincolnville with their issues. But when I found out that there was a new office in Halifax, yeah, I was thrilled. And they've worked with not just the communities I've worked with, but they're starting to work with other communities as well to look at legal redress. One of them being Harriet's Field, a white low-income rural community in Nova Scotia that's been dealing with water issues since the 1980s. So they see whether or not they can have private prosecution, class action lawsuits, which is probably not typical in Canada and has not really been done, and other legal remedies. I'm very interested in environmental racism legislation and justice. As you probably know, I've been trying to get this bill passed through the House of Commons, Bill C-226, which is now being sponsored by Elizabeth May. On June 22nd of this year, it was approved at second reading. On November 4th, it was approved at amendments. The Conservatives and Bloc Québécois put forth some amendments, but all were rejected. So now it moves to the next stage. Hopefully one of the next stages would be Senate. And I think when it reaches that stage, perhaps after fourth reading, it has a chance to become the first environmental racism legislation in Canada. This is based on the work that I did with Lenore Zan back in Nova Scotia. We just kind of reworked this bill. It was a provincial bill, and Lenore came to me in 2020. She said, why don't we turn it into a federal bill? And I said, yes. So we changed it. We made it a little bit more robust. I would say it has more teeth. We're asking the government to provide statistical data on race, income, toxic burdens, and health, which we didn't do in the first iteration of this bill. So I think it has more teeth now, and I guess we'll wait to hear what happens with it. I also engaged in national partnerships. I've co-founded another organization with somebody in Toronto. It's called the Canadian Coalition of Environmental and Climate Justice. We co-founded that in 2020, and that has brought together many environmental organizations across Canada to work together to try to address environmental racism across Canada in BIPOC communities. There's no longer kind of just a focus on Indigenous and Black communities. It's all BIPOC communities across Canada. And this want to end. Do I have time to end? Or am I out of time?
Yeah, we're getting, yeah.
Yeah? Okay, I just want to talk about...
Pretty close to the end, thanks.
Okay, I just want to talk about a few wins, because I know a lot of this is doom and gloom. I always say it's a doom and gloom issue, but I want to leave the audience with a few positive things that have come out of this in case they think there's been no progress. So I just want to say that the legacy of struggle, opposition, and resistance against environmental racism in Canada has led to several wins in recent years. At the end of 2016, the South End Environmental Injustice Society, SEED, in Shelburne, and their allies succeeded in closing the landfill for the first time since 1942. In addition, in the spring of 2020, Elliot Page gifted the community with a well, which is in the process of being installed. And Elliot's paying for that, paying for the annual fees, I guess, and that's being installed by a Nova Scotia environmental science professor. He's helping to do that. On January 31st, 2020, Northern Pulp Mill finally closed after the Nova Scotia government announced in 2019 that the mill had failed to produce an alternate plan for its wastewater treatment and ordered the mill to close immediately. In October 2021, 7 years after the project began, Alton Gas announced that they had decided to cancel the Alton Gas brine discharge pipeline project in the Sibonacity First Nation, stating that, quote, with the sale of the Nova Scotia utility, the repositioning of the business, and the challenging nature of the storage project economics, AltaGas has decided not to continue with the development of Alton and to move forward with decommissioning the project. While the former residents and descendants of Africville have yet to obtain redress, they continue to make demands for reparations. In November 2016, up to 300 former residents of Africville and their descendants joined an application submitted to the Supreme Court of Nova Scotia for a class action lawsuit against the city of Halifax over the loss of their land 4 decades ago. The application was turned down by the judge in 2018, who ruled that the plaintiff had not, quote, satisfied the requirements to certify the class action, preventing the case from proceeding. Africville descendants continue to fight, however, to make their voices heard. In 2020, they marched through the streets of Halifax demanding reparations, and a few months ago, a podcast series was launched titled Africville Forever. And the story continues. Thank you very much.
Thank you very much, Dr. Waldron. Want to let everyone who joined us know today that the recording for this presentation will be sent out. And a quick reminder to the students in Dr. Singh's course to please reconvene after the presentation on the separate class discussion link that Dr. Singh provided. And okay, all right, thanks very much.
Terrific. Thank you so much, Ingrid. That was really fantastic. It was just really great to hear all the details about your work. And yeah, you know, I remember reading Robert Bullard a long time ago in my earlier life, I suppose. In the earliest part of my academic career, I was doing risk perception and environmental contamination, actually. And so I thought I might just kick off with one quick question about that. And then we're a little pressed for time, so we'll probably just take one from the floor afterwards. But I wondered to what extent any of your kind of conceptualization of the mental health impacts of environmental contamination, environmental racism has drawn upon the risk perception literature, and to which I imagine is a fairly, you know, my recollection of it, which is again probably 20 years out of date, is that it is not particularly cognizant of racial issues, and if there's anything that you think might be recoverable from it that you know of. Anyways, it may be an answer. I haven't looked at that, but that's fine.
Very interesting. I haven't looked at that, but as you can see, when I talked about mental health impacts today, I talked a lot about perception amongst community members, and a lot of it is about perception. I know that when I did my postdoc at U of T a few years ago, I was looking at perceptions of racism, right? Because people often say, you know, they want you to prove racism, and a lot of scholars would say perception of it is enough, right? So actually, you know, what I found was extremely interesting in terms of how you perceive your experience of racism is real for the people who perceive it, and kind of connecting that to this issue of environmental racism certainly would be interesting, but haven't done it.
Okay, terrific. Well,
yeah.
there's a lot of cases around this area that the research group I was part of have investigated, and someday I'll get someone who really knows to tell you about the Upper Ottawa landfill as well. So in Hamilton, but look forward to that. At any rate, I'll take one from the floor again, just in the interest of time. I'm so sorry that I can only just take the one. If somebody would like to raise their hand, I will. We'll unmute you. No, I have discouraged anyone because of the time pressure.
I'm sorry, everyone. It's my fault.
It's okay. No. It was so rich. It was amazing. No. It was
that always happens.
amazing.
I run out of time. I'm not good at.
No, it's all good. It's all good. Don't worry about it. You've got plenty to share, and it's a great introduction to the McMaster community. Well, probably yet another one that you've had over the past year. But I'm really delighted that you're able to spend the time with us and share all of this. And I've got, you know, a dozen things that, you know, kind of random bits that I'd love to share with you when we get the opportunity that may or may not be relevant. But at any rate, thank you again. I'll just give one last call for a specific question. No, I think probably people's time has run out, and we're losing a few people just because of that. But thank you again. It was incredibly rich. We'll all go and watch the Netflix documentary to get more, I'm sure, and really appreciate your time. Thank you so much for being here. Okay, thanks.
Thanks. Bye.